In this episode, we're going to walk you through something we've really never done before. We speak a lot about sales and communication, what you would say, how you might say it, what you'll say on the phone, what would happen, and what you talk about on a DV or an eval, but we never brought you like inside the treatment room. And so in this episode, I'm going to walk you through very specific case studies about when you're in a discovery visit or when you're in an evaluation treatment session during your assessment process, and how we, what I call, connect the dots to the next step. And if you do this correctly, you are going to get DVs, skeptical people that aren't ready to spend the money, they aren't ready to take the time to be with you, and they're going to convert to an evaluation and treatment session, and then those people are going to trust you enough to hand over their money and trust you with their care. Remember, at the highest level, you cannot help a patient unless they become a patient. And what I'm going to walk you through today is behind the scenes in the treatment room, DVs and evals, that is going to help you make more money and build your business finally, because I know so many people get stuck because they're amazing clinicians, but they don't have the chance to treat someone because they don't know how to connect the dots, and then they don't know how to get more patients on their schedule, and then we're stuck. So stay tuned for this episode. And if you love this episode, because it's the first one we're doing, please let us know, like, subscribe, send me a DM on Instagram. It means the absolute world to us, and it helps us keep doing what we're doing. All right, so the format of this episode is, the first thing I'm going to do is introduce the body part and then the complaint of the patient. Then I'm going to bring you inside the walls of the treatment room about how I would do the assessment and what I would say to that patient. And then I will take you through the background and the reason why I'm saying what I'm saying. So stay tuned. All right, so the first case study, I'm going to bring Hannah in here in a second, and Hannah is coming in with neck pain. She's gone to the chiropractor, she's gone to PT. She typically gets regular adjustments that feel good for a couple weeks, but then the pain comes back. And so I'm gonna walk you through a very basic, what we would call an SFMA, top tier neck extension assessment, and then I'm gonna show you exactly how I would communicate with her. All right, so Hannah, what I want you to do is look up to the ceiling. How does that feel?
Feels okay.
Is it pain?
Yes.
So what's interesting, Hannah, is that when you look up to the ceiling, you see how most of the pressure is coming through the middle of your neck? Mm-hmm. And you did say to me that you had gone to the chiropractor before.
Yes.
So what I think might be happening based on what you're saying is, when you go to the chiropractor, it actually is helping you temporarily, but what they're doing is they're gonna be adjusting your neck, and they're actually adjusting the spot where you already moved from. Because what we want to happen when your neck is moving is we want it to be a C, meaning that all of the vertebrae in your entire neck is moving in one way. So we might not actually have to adjust your neck. It isn't that it is wrong, it's just that we actually have to get you moving through here and maybe through here, rather than right now you're moving through here. So that's something definitely different than what you tried in the past. All right, so you're gonna see a theme here. We call this value for unique solution, but essentially what I have to think about when a patient is coming into my practice is if they tried chiropractic and PT in the past, and specifically like a chiropractor in this case, if I'm gonna charge more money and I'm gonna do something different, I have to show them that I have a different solution to their problem. And so most patients that come into our office, this is a very typical case. They've come in, they've gotten their neck adjusted, it feels good, but the pain always comes back. And so immediately what I'm thinking is, if this patient is going to give me a chance and they're going to help, allow me to help them, I have to offer them something different, a different solution to their problem. And so in this case, it was a very classic example of a patient coming in, they've been adjusted, and when they go to bring their head backwards, you can see they get that hinge. For you clinicians out there, that's typically around the C5 vertebrae. And you know that when they go to the chiropractor and they just crack their neck both sides, they're just gonna get that spot moving over and over and over again. With these type of patients, and we're getting clinical here, what often happens is we need to get their CT junction moving, we need to get C7, T1, T2 moving, and above that C5 level, we need to get that moving. However, we have to communicate that. And so whether your treatment is some sort of DNS or it's some sort of McKenzie, that part is irrelevant, because we have to help explain to the patient why the solution that you're offering is different. Remember, the patients that are coming into your practice, they are already, if you've told them that you're out of network or you're more expensive, immediately they're thinking to themselves, okay, compared to what I already did that was cheaper, how is this different? And so if you don't communicate to them that what they've done in the past, it might have been helpful to get the solution that they were getting, which was temporary relief, you have to be able to show them something different. And by using that example of, hey, actually we might not have to adjust your neck anymore, not because it was bad, but because the area that you need moved is actually above and below the area that you're currently being treated. So this is where we talk through a sales position called value for unique solution, which is essentially, how do I show this patient that what I can do for them is significantly different than anything they've done in the past? Okay, so case study 2, Hannah is going to become a golfer. And in this example, I'm going to do another SFMA top tier assessment, which is a version of standing rotation. And you're going to watch how I talk to her about why her lack of rotation is affecting her golf swing. All right, so Hannah, what I want you to do is keep your hands at your side, and I want you to try and rotate one direction as far as you can. And so when you're doing this, Hannah, keep going. What I want to see actually is this shoulder. I want to be able to see it as I do that. And you feel when you do that, how tight that is?
Yes.
Now try it to the other side. Okay, so what's interesting, Hannah, is you're playing golf. Good, thank you. And so just check this out, turn around and face me. So you're playing golf and you want to, and I'll show the camera, you want to rotate your body all the way this way in order to get into your backswing. But what you just showed me was as you were rotating, you're like really tight and limited. So just imagine if, hopefully if you're good at golf, 80, 90 times, you're rotating your body and it wants to get to here, but right now you're showing me that it only gets to here. So it just makes sense that over time, as you rotate into a position that your body doesn't have, you're really going to struggle.
Right.
Okay, so another very classic example, if you are a chiropractor seeing golfers and we're getting to the spring season, late March, early April, where you will get a lot of golfers that come in, they might have back pain, they might have hip pain, they might have neck pain. And obviously we know that as a golfer, you have to be able to rotate. Now, you have to understand something as a clinician. You have the ability to see tens of hundreds of thousands of different case studies and patients. Most of the people that are coming into your office, they have no concept because they've never seen it before. And so when someone does their rotation and it's like this, they might think that's good. And in fact, compared to the rest of the guys at the club, it might be good. But you and I know as clinicians that they need to be able to complete their turn in their backswing. I know that clinically, I need to be able to see that shoulder all the way behind in order to get the results they're looking for so that they can get to their backswing. And if a patient comes in, now if they've seen a chiropractor or PT, this is a perfect example, they went in with lower back pain to their chiropractor and physical therapist, and they got back pain treatment. They went to the orthopedist, they got back pain treatment. They went to get an MRI and they'd MRI their lower back. We all know that that patient, the problem isn't their lower back is trying to make up for the fact that they can't do the rotation through their mid back. And so if you hear at my practice, Strive to Move, the thing we talk about is root cause. Well, the root cause of the lower back pain is the mid back lack of rotation. And if we don't have the ability to communicate that to our patient, remember the thing we talked about before, value for unique solution. This is value for unique solution. This is getting to the root cause. This is helping the client or the patient understand that what we are doing in our practice is totally different than anything that they've heard before. Because you know the majority of your patients, when they go to their chiropractor with lower back pain, they're going to adjust their lower back and then it's going to never solve the problem because the problem was in their thoracic spine. You know that if they're going to physical therapy, they usually arrive with a script from the orthopedist. The orthopedist says treat their lower back for 12 weeks and they might get amazing lower back treatment, but the problem is in their middle back. And so if you want to show someone how you can, number one, be different than everyone else, you have to speak differently than everyone else. If you want to show someone how you're actually getting to the root cause and speak in a language and in a way that is different from all of your competition, this is how you're going to communicate in your discovery visit, in your evaluation treatment session, and the patients are going to start to understand, this is different. One more part of this thoracic spine rotation, and I think it's actually really relevant. This example, so Hannah's background, she's actually a swimmer, and what we see over time is people that are swimmers, they have a certain presentation where it's normal that she actually won't be able to rotate very much. What I've seen time and time again is that we have people that come into our practice, they might have been a swimmer for 15, 20 years, and then later in life, they decide to pick up something like golf. And their body isn't really made or ready for that. It doesn't mean they can't get there, but they've done one activity their whole life and now they're trying to do something completely different. Again, what I'm trying to point out to you guys is that you have to be able to understand and communicate to your patients in a way that no one has ever communicated with them in the past. If I went in and said, hey, typically swimmers have a very tight thoracic spine because you don't need all that rotation when you're swimming and you're not used to being on your feet, it just makes sense that now that you're playing golf, we're going to run into a different set of issues. That patient's gonna be like, that makes sense. And now they're gonna be open to how you can solve the problem. Okay, so the next example is a patient coming in, CrossFit, and they have knee pain. And so what I'm gonna walk you through in this example is how I help to see how they're actually lifting the weights to know if the weightlifting is causing their pain. And when I was in practice, when I got into practice early on, this was one of the the keys that I saw specifically in the CrossFit community, that people would come in all the time with knee pain. They would go to the PT, they would go to orthopedist, and they would check out and say, your knee is fine. And then I would ask them a key question, which was, tell me when your knee hurts. And oftentimes the revelation was that their knees would hurt when they were doing something like deadlifts. And I was like, all right, so we have a problem here, and I'll show you that in a second. All right, Hannah, so you told me that you're having knee pain when you deadlift. So
Yes.
Do me a favor, I want you to show me your deadlift.
Okay.
Go ahead. And that hurts right there?
Yeah.
Okay, so now come back up and I want you to try something for me.
Okay.
So now when you go to deadlift, I don't want you to let your knees touch my hand, okay?
Yep.
Go ahead. How does that feel?
Better.
Good, come back up. And so Hannah, what we're seeing here is that, I see it all the time, people with knee pain when they deadlift, a deadlift is a hip exercise, which means that when you go to put your hips back, you shouldn't feel anything in your knees. And so what we often find is that we call it squatting our deadlift, where you should sit your hips back on your deadlift and you should squat during your squat. So if you came in here and said, my knees hurt when I squat, I would say that's normal. When you come in and say, my knees hurt when I deadlift, it seems like there might be a technique problem. So when you were at chiro and PT in the past and they were doing treatment on your knee, it's not that the treatment was bad, it was that they never actually took the time to watch you exercise. Okay, so this is where I think as rehab chiros that understand exercise and fitness, this is where we can really connect the dots for patients. Because a patient comes in to us very, very frustrated that they've gotten no results. They might wear a knee sleeve, or they might use a hot pack, or they might have gone to physical therapy to do knee exercises. They might even have got an MRI that says you have a meniscus tear and they think that their lifting career is over. But if they are fundamentally telling me that they do an exercise that is not meant for that area and it hurts a different area, then we have an issue. So in this model, in this exercise where they're saying my knees hurt when I deadlift, the first thing that I have to look at is what their deadlift technique looks like. And from a clinical care standpoint, if you don't spend the time therapeutically fixing their hip hinge so that they feel it in their hips and not their knees, I think you've done a disservice to this client. And so I think this is a key point for a lot of reasons. If we take it into the sales aspect, again, value for unique solution. How are you going to show that you are different from everyone else? If that's happening and you are speaking to someone in that way and you are able to take what they're doing in the gym and then connect it to the medical problem they have, I think that is a differentiator in your town and in your community because nobody else is doing that. And so they might have a meniscus tear. They might have a true knee problem, but that should be independent of how they hinge their hips. And I think what we have to really understand, like an example like this, is the reason you'll get buy-in at this level is because you are speaking in a way that a medical provider has never spoken to them before. Heck, I don't even think their trainers are speaking in this way. So if you bring in a client, they're gonna trust you like no one's trusted them before because you understand them in a way nobody understands them. I think that this is where we can differentiate ourselves as a rehab chiro or as a performance physical therapist to be able to take what's happening in the gym and connect it to what's in the clinic. And from a pure sales and conversion perspective, if you can help someone within just changing how they move their hips, that, oh wow, my knee doesn't hurt anymore, that is a quick win. When you can get a quick win with a patient, they're in, they're bought in. And so I think that this is the number one thing that you can do is to really have a keen ear and eye for movement patterns that you know are just a little bit off that you can help fix in the gym so you can keep them in the gym, you can work on the medical issue and you can connect the dots. Long term, I just don't see a world in which you're not going to make more money, you're not going to get more patient conversions when they trust you, when they know you understand them better than anyone else in their community. All right, so in this example, I'm gonna bring Hannah in and do an overhead flexion exercise. And what she's going to show is that she has a difference from side to side. And then what I'm gonna do is, she's a CrossFitter, I'm gonna connect the dots back to barbell lifting. In my experience, when I first got into doing seminars, this was a breakthrough that I had when I did a seminar to help them understand that if they can't get an overhead position and it isn't equal, of course, a barbell is going to hurt them. So I'm gonna show you how I would walk through this and connect the dots for this patient. All right, so Hannah, what I want you to do is put your feet together. I want you to put your hands at your side, thumbs towards the sky, and I want you to lift both arms overhead. I want you to stop when or if either arm hurts. Good, so what happened?
My left arm is hurting.
You feel pain here.
Yes.
Okay, and so your biggest issue right now is at the gym Barbell doing overhead work.
Yeah.
Got it. Okay, so what I want you to think about now is a barbell is a straight bar, which is requiring both arms to get and do essentially the same thing. But what you're telling me is unweighted, not tired, no external factors, that when you go to bring your arms up, this arm can do everything you need it to do, but this arm, not so much. And so it just makes sense that if you're trying to add weight and add reps and add load to a press, that both your arms literally do not do the same thing.
Yeah.
So how can we expect that in a workout setting, when you add fatigue, that your arms are gonna do the same thing? I'm surprised you're not in more pain. So they say the number one thing in communication is make sure you explain it in a way that a fifth grader could understand. And so in this example, Hannah comes in and she's having trouble with a barbell at the gym. And it's a very normal thing that when someone has a shoulder issue, they'll come into the office and they'll do a test like that. And they're like, yeah, this shoulder's good. And this one, it gets stuck right when I bring my arm this way. And so it just makes sense that if we're in the gym asking both arms to do the same thing, and then in a very controlled environment, both arms don't do the same thing, we're going to have a problem. And so I kind of said to her at the end, and it's often serious, like, I'm surprised you're not in more pain like this, because if you think about weightlifting or any activity, you're adding fatigue, you're adding more weight, you're adding other external factors to it. And so every problem that we see in a controlled environment like the office, it's just going to get worse. So in this example, I wanted to make it very logical and very clear for her that, hey, both your arms, they're different. You just told me they're different, but you're asking them in the gym to do the same thing. Of course you're gonna have a problem. And it's like, oh yeah, that makes sense. Now again, and I said this at every juncture of this podcast, of this video, that the thing that you have to recognize is that your patients are looking for every reason not to work with you. They're looking for every reason to use insurance, to not spend the money, to not spend the time, to not spend the effort to go and see you. And if you do not show them in real life how you are different, they are gonna have a very easy reason to say no. And if you confuse them, they're definitely going to say no. And so we say that a confused buyer doesn't buy. If you don't explain to them, you can explain to them internal rotation, external rotation, you can explain to them DNS 3 months, all those things, they're great. But at a very basic level, if they don't see, I need to do the same thing with both arms and one arm is different, if they don't understand that, the rest is over. And so we talk about how you're communicating with your clients and we talk about what you can say in the script, but I think that where I want to wrap this video up is to let all of you know that are either listening to this or watching this video that you guys are best being clinicians. You are a clinical savant, and oftentimes we have the ability in the clinic to show people what their problem is. And so on the phone, you have to talk to them. You can't use visuals. But what I wanted to do in this video and in this podcast was help to show you how you can use the sales skills that we teach and we learn to be able to utilize them in the clinic, because it's hard to translate. If you can show up and be a high-level clinician and do a high-level assessment, and then you can communicate in a very basic way that helps the patient understand, it's inevitable that you're going to get more patients across the line, you're going to get more patients to say yes, and you're going to be able to help more people. Down the line, you're going to make more money, you're going to build the life that you want, you're going to get more free time, and you're going to build the business of your dreams. This is the number one way to do that, to understand how to treat them clinically, to understand what their problem is and communicate with them, and then actually be able to solve their problem. So I hope you enjoyed this episode. It was a special episode. If you liked it, please send me a DM on Instagram. Let me know what you liked about it, because this is an episode I will do more of if you're enjoying it. All right, guys, thank you for listening. If you enjoyed this episode, the best way for us to promote it is by you, the listener, the viewer, sharing it with your friends. Text it to them, put it in your Instagram stories, and share the link. It will absolutely help this podcast grow and help us spread the word. Hey, and if you're looking for more help, I have 2 ways that I can help. You can go into the show notes and book a strategy call with our team to see if it's a good fit, to see how we might be able to help your business grow. Or if you're not ready yet, there is a checklist that you can go download, a free checklist that I built that hundreds and hundreds of people have downloaded. So go into the show notes and you can download that.